let that go. It's okay that you're a human. It's okay that you're struggling with this.
And the good news is that it's very treatable, and there's hope for living a life free of OCD, living in the freedom that God has for you. Welcome to Tea with Dymphna. I'm Elizabeth.
And I'm Lauren, and we are Catholic psychotherapists who work in private practices.
So Lauren, tell us more about what is OCD?
So OCD is a anxiety disorder. It's a subcategory of anxiety. And there are multiple subcategories of OCD. Scrupulosity is specific to religious fear. So it's a way that your anxiety kind of takes over and you can become very rigid and ritualistic about your faith, and it takes over and it becomes a monster of its own.
Can you give some examples? Like, what have you seen in your own practice of someone with scrupulosity? Like, how would they know that they have it? What are some of the symptoms and telltale signs?
So overall anxiety about hell, like going to hell, is a really, really big indicator. Ultimately, OCD is when a person begins to ritualize aspects of their life and they think that if they don't do these things, some horrible thing will happen, and they associate any compulsions that they have with relief from their anxiety. So their brain will generate like, okay, you have to pray this rosary, and if you don't pray this rosary, then your mom is going to die, or you're going to go to hell, or someone that you love is going to go to hell. And so that's indicated by like placing ultimate importance on these small ritualistic types of things. The obsession is, I don't want to go to hell, or I don't want my loved ones to go to hell. The compulsion is ritualistic prayer, and other ritualistic behaviors. Like confession is one.
Yeah, that's actually something that I see a lot in my practice. Catholics who come to me and they tell me they go to confession and they leave confession, and instead of feeling relief and closer to God, they feel like, what if I didn't say it correctly? What if I forgot to say something? What if I didn't explain it correctly? What if through my failure of doing the right kind of confession, actually did not receive forgiveness of my sins, and therefore I'm not forgiven, I'll go to hell. And then what happens is, in order for them to feel at peace and not anxious, their OCD tells them, you have to go to confession again, you have to do it again. And then they go again, that kind of like ritualistic, like doing it again. And then they leave and they still feel anxious. And usually it gets worse the more they comply with that inner urge of, you have to do it again, it just didn't sit right. And what's at the core of that is the inability to tolerate uncertainty. I mean, there is a level of faith, right? Like, I trust that my sins are forgiven, but the OCD will come in and say, but what if, right? What if you missed something? What if you didn't do it correctly? Well, the priest said he forgave you, but what if you didn't say everything and that one thing wasn't forgiven? Or even, what if you forgot a big mortal sin? That's something I see it too. What if you committed a mortal sin, like on Sundays, receiving communion? What if I committed a mortal sin? You shouldn't receive communion. And the logical part would be like, well, I mean, obviously, right? If you committed a mortal sin, you would know.
Right.
You would know, otherwise it's not a mortal sin. But they're like, but what if you forgot? What if? And then you will receive communion in a state of mortal sin, and that's a terrible sin. Or this, again, I have to go to confession because else what if I die now? What if I forgot? Or what if I missed the fact that I just committed a mortal sin? And they will think about it and obsess about it and go through the whole week and try to remember. And the more they think it through, right? The idea is that if I just think about it long enough, I will feel at peace. If I just say the right confession, I will feel okay. But the problem is that never happens, because the more we comply with OCD and the scrupulosity, the stronger it gets, because we're telling our brain, this is relevant, this is a true fear. And so we don't get that feeling of relief by complying.
Yeah, absolutely. I've seen the same thing. And that's really all anxiety. When you give into anxiety, I always say it's a bully, and it will bully you your entire life until you stand up to it.
So the very first step that I work on with my patients is to help them learn how to identify what's OCD, when is it my scrupulosity, because if they can identify it and name it, then they can say, okay, this is what I do when my OCD strikes. You'll get better at identifying it the more you practice, the more you kind of become aware of it. And some telltale signs of that are the urgency that we were talking about earlier. Do I feel like I can't even wait 30 seconds? Does waiting 30 seconds to think about this or to do the action or the ritual feel excruciating? Mm-hmm. If you have that sense of urgency, that's a pretty good telltale sign. Also, if you have those like accusing words, very like putting down, all those kind of words are typically your OCD.
Yeah. The OCD is not like your enemy. It's not, neither is it your friend. It's something that exists in essence to keep you safe. Mm-hmm. And we can acknowledge that that's a good desire on some level. It's in overdrive. So we might look at like, we might do some psychoeducation about like, and you said that you would do that. You do that typically with your patients when they come in and you diagnose them with OCD. You might spend a whole hour session talking about this kind of thing. But really, I do think it's important just to acknowledge like when people hear like, oh my gosh, I'm exhibiting all of those symptoms of OCD. Oh, my OCD is horrible. And I'm going to have this for the rest of my life. Like the fear of like, I'm going to have this bully in my brain. And while I do say anxiety is a bully, if you let it bully you, it will take over your life and it'll take over more and more of it. The point here that I'm making is like, especially with intrusive thoughts, people become so anxious about their intrusive thoughts. They're like, I just thought about, I'm going to give some extreme examples here. So, but people will say like, I just pictured the priest naked, or and I want to be clear about these because like, I hope this doesn't scandalize anyone, but the reality is like, these are real terrors that people are living with. And so I do want to be explicit about like, these are some things that like, maybe you are struggling with. They might think about like pornographic content that they don't want to envision, or they might think about hurting or killing someone. And they know that these things are sinful and, I want to be clear, they would be sinful to do. Just having an intrusive thought is not a sin.
Right. Yeah.
But the point that I'm making here is like, if you demonize your OCD, those kinds of things can escalate and feel really, really big and scary because it's like, how am I ever going to escape the tyrant of this thing in my brain? Yeah. And so one of the things that I teach people is like, it's just a thought.
Yeah.
And that's all OCD. Like, it's just a thought that is there to try and protect you. But you know what? It's unhelpful. And often I'll have people thank it. I'll just be like, thanks OCD for trying to alert me to a potential danger. There's no danger here. And I want to also talk about how like when you're talking about intrusive thoughts, especially if you're talking about like some people have like, for example, pedophilia OCD. The reason that the intrusive thought is so distorted and so like, what I mean by distorted is sick or disturbing. The reason that it is because it's your body it's your brain picking the worst, scariest thing it can think of to animate you into some kind of compulsion. So that's why when you're having the intrusive thoughts, they're like the most disturbing thing you've ever thought of. It's because your brain is like, what's going to disturb my person the most to animate them into action so that it can save their life. So I really want to just not demonize it because I think that sometimes when it gets that way, it can feel like people are like, what if I have these kinds of thoughts for the rest of my life? It's like, okay. Yeah. They're just thoughts.
Yeah. Oh, that's so good, Lauren. I'm so glad that you're touching on this. Yes. What you were saying of the OCD is just thoughts. I think that's a really important point to make, is that thoughts don't always point to the truth, right? Just because you have a thought doesn't mean that that's congruent with what you want or your values. It's like you were saying, Lauren, it's like your brain trying to figure out how can I get my person's, I like how you said that, how can I get my person's attention? And usually it's with something like horrific. That is really hard to like not focus on. That's one thing that I usually get to with patients once they've like their OCD calms down. I like to look at what is the purpose of your scrupulosity, of your OCD. And actually, I think, Lauren, we should probably make a whole episode about that. What is the purpose of your OCD? Because it really is trying to fight something off. It's trying to protect you from something, like you were saying. And it's trying to be like, look over here, don't look at this other thing that I think is really scary for you. And that thing that's really scary for you could be anything like a memory, an experience, a trauma that your brain is trying to protect you from. So really, I agree with what you're saying, Lauren. The OCD it's trying to be your friend in a very unhelpful way, in a very dysfunctional way. But the other thing I always tell my clients to give them hope is that usually, in my experience, the patients that come to me with OCD have some of the more higher like suffering and like pain level. But if they use the skills and tools that we teach them, their progress is typically pretty quick. Like the symptoms actually go down surprisingly fast.
Yeah.
Don't think that you're going to have to use these skills, these tools, this being reckless and I'm going to sit with this for 30 seconds and it's really hard for forever, because you are retraining your brain to actually calm down that inner alarm system. So actually with time, the urges are going to become way less intense. Your brain is going to send you those signals less intensely, less frequently, and you're going to be more confident in knowing that this is just a thought and I don't need to comply. They're just thought. It's just noise, right? Your brain is so noisy. There's always thoughts, and some thoughts are relevant and others aren't. But absolutely, if you're in that boat of feeling defeated by your OCD, like we're here to tell you, like we've seen it over and over again, that like OCD is actually very treatable. Would you agree?
Yes.
It's one of the diagnoses where typically we see progress pretty quickly. And it is, again, right, like you start level 10 up here. It's hard to do, but the fruits come pretty quickly usually.
A really common like therapeutic recommendation is exposure response therapy, which is essentially exposing yourself to your fears. People do like exposure ladders and all kinds of things in order to begin to tolerate things that are uncomfortable. That's a key component to solving OCD.
Can you give an example? Like what would that look like to expose yourself to such anxiety? And then what would you tell them? Like what should they do as they're sitting in that discomfort?
Yeah. Right now, all the exposure things that I'm thinking of are not religious. So I might use a non-scrupulous example, but an example that I've used for just working with OCD in the past. So let's say someone has an obsession with checking. So checking means that's a subcategory of OCD. That means perhaps you consistently check doors. What I would have someone do is we would build an exposure ladder. And an exposure ladder is from 0 to 10. What are behaviors that feel like 0 being this is like tolerable, completely tolerable. So something that's completely tolerable for a door checker is checking the door. Like whenever I feel like I need to, I go and check to make sure that the door is locked. A 1 might be I wait 30 seconds before I go and check the door. A 2 might be I have to go at least 2 hours without checking the door. When you work your way up to 10, it's when I have a compulsion to check the door, I remind myself I've already checked the door and I let it go. And I address the inner thought that like usually people's checking compulsions, they don't realize it, but they're connected to some innate fear. And they believe if I do this, I'm like, it can be as grand as like, I'm saving my mom's life. Like it can really be that grandiose. And so the idea is like, that is not realistic. And it's not like people with OCD are psychotic or something. It's not like they know that sounds irrational, but they also have this strong inner anxiety that's compelling them to do it. So yeah, you just resist it. You acknowledge like, this makes me uncomfortable. But in time, I will grow less and less uncomfortable with this. And in fact, it will have less of a hold on me over time because I'm proving to myself that this actually has no connection to reality.
Yeah, I love that ladder, increasing the amount that we wait.
Yeah.
And to be clear, as you were saying, what was number 1? It was waiting 30 seconds. That, for somebody who really struggles with scrupulosity and OCD, 30 seconds can feel really long.
Yeah.
And as we wait and not check and not do the ritual or not go back to confession, those 30 seconds feel very hard, right? And the discomfort is very, very great. And it feels as if we're being like reckless, right? Because our OCD might say like, if you don't comply now, something bad will happen. Like you need to do this now. So that sense of urgency is typically a pretty good telltale sign that you're dealing with scrupulosity, OCD. If you can't wait 30 seconds, if you can't wait half hour, 2 hours, if waiting 2 hours seems reckless and very dangerous, That could be a telltale sign. And then as we sit in that discomfort, like you were saying, we sit in that discomfort and we practice, we increase our tolerance for uncertainty. And we're giving our brains the feedback that I don't actually have to do anything about it. I do not need to respond. And you know how they say, don't just stand there, do something? I always tell my clients, don't just do something, stand there. Right, yeah. So what you want to do with when you have those urges is to not respond. Nothing, right? And I like to give my clients the phrase to use, I'm not going to answer that question. My clients hear me say that all the time. I'm not going to answer the question. But what if you committed a mortal sin? I'm not going to answer the question. But what if you die in the next minute and you'll go to hell? I'm not going to answer the question. As we go through that, you can see that is going to feel very reckless. And so I always tell my clients, yes, it's going to feel very reckless. And as you resist, like you were saying, Lauren, the discomfort rises and rises. That's how you know you're doing it right. You have to let the discomfort rise. You gotta have to sit in it. As hard as that is, I know it's so hard, right? Like the things that we're kind of talking about, they sound simple, but when you're actually doing them, they're so hard, right? Painful. Really, really painful, very anxiety inducing, because our brain is really convinced that this is something we need to, right? It's like our whole inner alarm system is going off and it's telling us danger, danger, danger. And here we are being like, I'm not going to do anything. And that's really hard, but that's really the only way to eventually get the OCD to decrease. One analogy that I like to use with my clients is the mosquito-bite analogy.
No, I don't know it.
It's basically, I tell my clients, imagine your OCD like a mosquito bite and the urge is to scratch, right? All of us know we shouldn't scratch it. Not only because it'll make it infected or aggravated more, but it's also not actually going to make it stop itching. Right?
It actually makes it worse.
It makes it worse.
Yeah, it's a great analogy.
Do we still itch? Yes, right? Right? We scratch the itch because we want to relieve the discomfort, even though we know it's going to come back, right?
Yeah.
We do it anyway. And the more we scratch, the more it itches. What is the best and fastest way to make the mosquito bite stop itching? We don't touch it. We don't do anything about it. We just leave it. What happens when we stop scratching? The itching becomes worse. At first, right? The discomfort increases and becomes really, really bad. That's when it's the hardest, right? Those first 5 seconds when we're not scratching, that's when it's the hardest to resist. The longer we wait and don't scratch, it becomes less and less itchy. It becomes easier to resist it. And the more we do that, right? If we actually don't scratch it at all, it actually heals a lot quicker than if we scratch. It'll itch for more days. So that's kind of an analogy I like to use to explain in very simple ways, right?
I love that.
Yeah, so not scratching your mosquito bite.
That's really smart. You touched on ways to treat OCD. You talked a little bit about that. So I talked about exposure response therapy, but I know that in the past you've mentioned that you often use CBT. So will you explain a little bit how you might with CBT, what does that look like?
Yeah. Well, the first thing that I would say is kind of what I touched on earlier of using the powerful phrase, I'm not going to answer the question, because what we want to do with the CBT method, what it kind of aims at is disengaging, to not engage. And that means even not affirming myself and saying, I went to confession and God says he forgave my sins and the priest told me my sins were forgiven, go in peace. So I'm okay. Because that's already engaging, because your OCD is going to pick that apart. It's going to say, but how can you be sure? What about this? What about that? Maybe he wasn't paying attention. The more you try to affirm yourself, the more your OCD is going to get that sliver of doubt in.
Yeah.
And so the point is to not engage at all, to not answer any of its questions, to not engage at all. And you might have to say that sentence, I'm not going to answer that question 100 times. So that would be the first thing. And then the next thing is resisting the urge to seek reassurance. That's a big one. Seeking reassurance can look like going to talk to a priest and saying, did I say that right? Asking friends and family. Googling is a big one that I see. Because every time we seek reassurance, again, we're scratching the mosquito bite, we're engaging with the OCD. So that would be the second thing. The third thing is to do the opposite,
Yeah.
right? So basically, when your scrupulosity tells you you need to go back to confession, you don't. And the thing is, if you really feel like you shouldn't receive communion and you're making that decision from a place of peace and like your own free will, by all means do that. I think there can be very valid reasons to not receive communion, but it should come out of like a free will, right? Like your own decision. Because whenever you comply with your OCD, you're not free,
Right.
You're not making that decision because you think it's the right decision. You're making that decision. You're not receiving communion because you don't want to feel the discomfort. And that's not what should be guiding your decisions. So those are the three. I'm not going to answer the question. Do not seek reassurance and do the opposite. So that's kind of in a nutshell the CBT strategy that I use with my patients.
Lovely.
What would you say, maybe someone is watching this who's a priest or maybe like a spiritual director caring for people in their parish, and they have someone that has these kind of questions, anxieties, seeks that kind of reassurance over and over again, or maybe a priest finds that a parishioner goes to confession multiple times in one day. What do you think would you tell them to respond well and to help that person?
There are other resources that priests and spiritual directors can recommend. I know I was once told by a patient actually who had spiritual OCD that they utilized a website called Scrupulous Anonymous. So it's like AA, and there are 12 steps for scrupulosity.
Oh. We can leave that resource link in the show notes.
Yes, we will. But so that can be really, really helpful. They might recommend like, hey, I know this website, and maybe you take a look at it, and if you identify with the things on this website, there are some recommendations. So I know that I believe the priest's name is Father Santa. I could be totally wrong, but I think Father Santa recommends that you have a psychotherapist and that you have a spiritual director who's schooled in scrupulosity.
What would you say to someone, like, have you had this happen that a patient comes to you and says when they have those scrupulous thoughts that they have the fear that what if this is God speaking to me?
There's never a time when the Holy Spirit is going to accuse and condemn you. Like, we know that the Holy Spirit moves in peace. He's the advocate. He's the paraclete. He's our defender. So when you notice that, rather than feeling like we can feel chastised by God, that's a good and healthy thing. But there's a difference between being chastised by a loving Father and feeling like, if I don't do this by an act of my own will, right? Like, if I don't, by an act of my own will, save myself, I'm going to hell. Well, okay, well, this is antithetical to Christian belief. We cannot get to heaven on our own. He might convict and chastise us, but like with hope and trust that he's going to rescue us, not that we need to rescue ourselves. Yeah.
Oh, that's so good.
The underlying assumption is that you have more control than you actually do, which is, by the way, very this. I'm saying this because it is important to recognize it's the same concept that's going on in scrupulosity. You actually aren't in control. Let me just say this. You are not in control and never will be of whether you are going to heaven or hell. Like, you are not in control of that. Let that go. It's okay that you're a human. It's okay that you're struggling with this. It's a disorder. Jesus is going to save you if you surrender yourself to him and you trust him.
Well, we hope you enjoyed this episode on scrupulosity. Leave us a like and a comment below if you have any other topics that you would like us to talk about. And until next time, God bless you and have a good day.
Yes, this is it. It's a cultural question in my mind.
Got it.
Okay, praise.
Okay, praise. Did you say praise?
Yeah, praise.
Praise God.